Good morning. Welcome back to the OHSU Effect. Thanks to the internet, bullying has become a huge concern for parents, and it's made others realize just how prevalent this problem is. Dr. Ajit Jetmalani is the head of child and adolescent psychiatry at OHSU Dornbeckers Children's Hospital and the Joseph Professor of Resident Education. His clinical interests include the treatment of children with Tourette's disorder, attention deficit hyperactivity disorder, and obsessive compulsive disorder, as well as the impact of psychotherapy on the well-being of children and families under stress. He is active in developing public health policy in support of access to high-quality mental health services, and we are fortunate enough to have him on the show this morning. Thanks for being here.
Well, thanks for having me.
Let's start at the beginning. What is the difference between teasing and bullying?
Well, that's a good question. Teasing really is a part of normal human behavior. It's part of engagement between two people that actually is something that people who like each other can do at times to engage. It becomes bullying when one member of that duo is actually intending to cause harm or to gain power over the other person. And the person who's receiving it is actually experiencing it in an intimidating way or a frightening way. So it's really about the intent of the teaser and the expression or experience of the person who's receiving the teasing.
It sounds like it could be a fine line, though.
It can be a fine line, that's right. And, oftentimes we want to teach children who are still learning their social skills how to deal with teasing effectively interpersonally. Sometimes children who have a somewhat shy or reticent personality can experience normal teasing in a very negative way. And if the person who's teasing doesn't appreciate that and continues to tease, then it's truly a bullying experience.
How many kids fall victim to bullying each year?
Well, victims, a number of studies have looked at people's expression of whether they've been bullied in the school-age population, and it appears that about 20% of children in any 3-month period will express that they've been bullied repeatedly. So it's a very common phenomenon over a short period of time in a child's life. Now, all of us have actually experienced bullying as observers, or some of us have been bulliers or have experienced bullying as a victim. So really, it affects all of us in some way, especially if you add the group of people who observe and do nothing about it.
Is there a certain age where bullying starts?
Really, in terms of the peak is actually in grade school. We see a lot of bullying in midway through grade school, which seems to be the time where kids are really kind of seeking out mastery of engagement with others. They're trying to understand the use of power and control, and that gets out of control for some kids. So we see it peaking really in grade school, continuing into middle school, and then reducing in frequency, but not necessarily in importance, as we get into high school age children.
Yeah, because we even hear about workplace bullying in adults. So it really seems like a problem that doesn't always go away.
Absolutely right. It's a problem that seems to continue throughout life. It's a factor in how countries treat each other, how cultures in general affect their population. And then interpersonally, we see it in the workplace, certainly on an ongoing basis. It's a problem, though, that starts in childhood.
Well, what makes some children more vulnerable than others?
The issue of vulnerability is an important question because what we see is that children who are quiet, who are shy, who are isolated, who don't have a peer group that protects them, those are the passive victims of bullying. They're kids who actually don't have the protections in place to protect them from the kind of predatory behaviors of others. The other type of kid who tends to get bullied are children who have kind of what's called the active victims of bullying. Those are kids who are maybe impulsive, who tend to make a lot of social mistakes, who stand out in a crowd because they make social mistakes, and then they get bullied. An example of that is kids who have Asperger's syndrome or a form of high-functioning autism who don't get social cues and then become victimized because of that.
Do you try to tell a child, I don't want to say how to behave normally because they all have their own personalities, but do you try to give them tips on how not to be bullied?
Yeah, strengthening the child in terms of developing resistance and resilience against childhood bullying is an important aspect of trying to intervene. So sometimes we will work with kids, particularly on managing the issue of teasing, and also support them in developing a peer group. That's probably the key is children who have a peer group around them who defend each other are much less likely to be bullied. Children who have impulse control problems like attention deficit disorder, who are hyperactive or impulsive, addressing those issues medically or therapeutically can also be helpful to help them protect themselves from this.
Well, let's talk about the opposite. I mean, what makes a child more apt to be a bully?
That's a very important question as well, because we often focus on the victims and then have fairly rigid and actually ineffective approaches to bullies themselves. Bullies oftentimes are children who have been bullied themselves, either in their family situation or in the school. They've experienced an atmosphere of negativity, and or they also have impulse control problems. So kids who are bullies tend to have other mental health issues as well. They've had significant trauma in their life story. Children who've been traumatized, sexual traumas, physical traumas tend to bully. Children who have impulse control problems like ADHD, for instance, have a higher incidence of that leading to bullying behaviors because they actually are trying to navigate social life without the impulse control aspects that we have normally. And they make a lot of mistakes and carry a lot of baggage from that experience.
And what makes a child more likely to grow out of being a bully? You said it kind of lessens in high school, but not always.
That's right. I think that really it is the culture within which the child is being raised and going to school. So in a child with a home that's intervening and responding to those sort of behaviors, or a school setting where there is actually a cultural approach to improving the situation, children can actually diminish their bullying behaviors over time. Kids who have a more difficult time turning those issues around actually are children who've had such severe trauma, neglect, or life experience early on that impacts their attachment. So attachment really is a process that we develop empathy through. When we have strong attachments to our parents and others, we experience the capacity for empathy. And the capacity for empathy is probably one of the leading missing pieces for kids who are active and persistent bullies.
Well, you kind of talked about the difference between teasing and bullying, but can you kind of go into detail about some of the ways that kids are bullied?
Yes, I think that's an evolving issue. You know, if you look at the literature, it's really focused on things that happen in the schoolyard and interpersonally. And of course, in our culture now, cyberbullying is a huge issue, and we can talk a bit about that. In terms of the types of bullying, so we look at verbal bullying. So of course, that's using language in an experience that is intended to either intimidate or embarrass somebody in a group setting oftentimes. This often is an issue of power and control. So it's really setting the child up with the use of language to look foolish, to be embarrassed, and then to gain a false sense of respect from their peers. And that can happen in a school setting where the issue of bullying and aggression and a lack of respect is not being addressed actively. The other issue, of course, and obviously, is physical bullying, and that takes the form of hitting, tripping, pinching, anything that causes pain to a child, either overtly in a large setting or privately. Bullies will pull aside a vulnerable child who's isolated, who doesn't have a peer group, behind the school or in the bathroom, various places that are quiet or private, and inflict harm to them privately. Cyberbullying is a phenomenon that is particularly worrisome because it takes very little time, and there are very few barriers to making a decision online. To share somebody's private email, for instance. So sharing a private email of another child or a text message and forwarding it, that's private, and with your peers that would embarrass them is something that you can never take back. It's floating around forever then in cyberspace. It's a decision that maybe somebody who has impulse control problems but isn't sort of a full-blown bully can make impulsively and then create weeks or months of hurt for the child who experienced that. Cyberbullying is an issue also that's harder to impact through cultural change in a school setting or a family, for instance, because it's hard to observe what's happening.
I was going to mention that. There's no observers to step in and say stop. This is can be a very private thing.
That's right. That's the real risk of it. Can be very private. You actually are not directly facing the victim, or the victim can't face the bully. Sometimes it's anonymous, of course, and that leads to much greater challenges around how to manage and control these issues. Really, which gets back into culture change. in our society, but also in our schools and our families.
What do you see more of in your practice? Cyberbullying or in-person bullying?
I'm not sure I could say what I see more of. I think what I see, though, is that frequently children who are victims of bullying come for mental health service because of a whole host of issues, primarily around depression and low self-esteem.
Well, we have a lot more to talk about. Can you stay with us?
Absolutely.
Dr. Ajit Jetmalani, more on bullying on the OHSU Effect next.